Ngayon, naka-live na tayo. We are now live.
Naka-live ka sa FB?
Ngayon, naka-live na tayo. We are now live.
Share natin. Naka-live ka sa FB?
Naka-live na tayo. We are now live. Wait lang po.
Share natin.
Sa ano lang po, sa YouTube. Pero pwede natin i-live yan sa Facebook. We can live this. Can you also get something? Because we also have this one. Good morning. Okay. Let's. Okay, so far we have 19 attendees, and I can see that we only have 5 minutes to start, to begin. Let me check if Dr. Raschel is already in the room. You know, especially those leaders who have downlines or business partners, which is non-Filipino partners. This training is actually will be very, very helpful for them because it's intensive product training and it's in English. Let's check. Is Doctora here already? Let me just check. Okay, so before we begin, we still have a few minutes until Dr. Rachel is enter in the room. So to my co-host, please help me accept those participants. Okay. We have some ground rules or house rules that we need to acquire. Okay. So for those who have video on, we request everybody to position ourselves in a decent manner. Let's avoid, lying down, and if you think that you're at work, then we understand. You can put your video off. And we request also, once we started the meeting, we request everybody to mute our microphone so that we won't be able to distract our presenter later on. Okay. Also, we would like to request if we can focus and participate in the meeting, and we can interact the speaker through our chat box. All right. And we request also to not to interrupt the speaker or question the speaker while she's on while she's talking or presenting. Okay. She will be giving you time to she will entertain you after the presentation. All right. By the way, this the presenter today, okay, uh, she's currently in the Philippines. So imagine it's already 11 p.m. in the Philippines right now, and here in the UAE it's just 7 o'clock. So let's take this opportunity really to learn, okay, more in detail about our products. Are you excited? If you think that you're excited, we can try to use our chat box. We can use it to communicate to each other, and even the questions. If you have questions or anything you'd like to say, you can use our chat box that you can see down below your screen. Just click more and click chat, and here you go. Here you there. All right. Okay, we have 27 attendees. Okay, we'll wait for Dr. Raschel. I think she's still not. Is she here? No, not yet. All right. Okay. Keep on sharing the link, guys. Keep on sharing. While we are still waiting for Dr. Rochelle, we can still send this link to our business partners, to our family members, because for sure this is not just about our products. This is about our health, right? If you're concerned with your family or to someone, you can probably share this link. Okay, today maybe somehow we can save lives, especially in this pandemic time, in this trying time. Those people who are losing faith already, or those people who are actually in um, those people who are actually having sicknesses, right? Or those who are infected with COVID-19. Yeah, we can educate everybody here. Yun, we have to attend this already. And we are about to begin. Okay, let me just share our screen. Okay, I guess everyone is excited. Okay, is Doctora inside the room already? Because as per Coach Maricar, she's here. So while we are waiting for Doctora Raschel, okay, we can probably use our chat box, to say hi and hello, to greet each and every one of you. We have how many attendees? 43 attendees. Okay. And I would like to thank each and every one of you for giving us the opportunity to share this training that we believe can help each and every one of us, and especially our loved ones, to know how we can actually take care of our health ourselves, especially in this pandemic time. Yes. Good morning, Hannah. Good morning from Gemma de la Vega. From who else is here? Okay, from Gemma de la Vega. Good morning, everyone watching from Barcelona, Spain. Wow. We also have people listening from Oman. Hello po. Who else are here? Who else is here? Okay, Anthony Bobadilla, coach. Good morning. Okay, from Teresita Perreda from Saudi Arabia. Hello, hello. Okay, from Doha, Qatar, coming from upline Maribik Anoyo. Hello. Coming from Gloria. Good morning. Who's listening to UAE and in the Philippines? From UAE, who's listening from UAE? Coach Sagira, how are you? And Juvie Tokmo, good morning. Okay. Okay, Jovelyn Pagaduan, watching from Kuwait. Hello, hello. And of course, my pricing leader from DRC. Hello, Patrick from Congo. That's right. Hello. All right, Hannah. Hello, Coach Myla, watching from Switzerland. San po kayo? Who else is here? Okay. Someone messaged me in a private message.
Ali, tama sa headphone.
Hello, Coach. Hello, Coach Aida Morales from Dubai. Okay, guys, keep on sharing the link. Unfortunately, we only have 100. We are only allowed to accept 100 participants, and so far we are already 57. So keep on sharing the link, and while we are still waiting for Doctora, uh, you know, we can still share our link. Even if they are not member yet in AIM Global, you can probably, help them to know about our products. Yeah. I believe Dr. Raschel is here in the room. Good morning, everyone. Once again, we are very, very excited for tonight's product training. Actually, Doctora, are you here? Yes, I can see her.
Yes. Good morning.
Good morning, Doctora. First of all, we would like to thank you for giving us the opportunity for you to be guest here tonight in our English session. Okay. I think last 2 weeks, it was Tagalog session, and
Yes.
I was the first one who actually took and asked permission if I can get English version or session here in Empowered Consumerism Alliance Core Group, okay? United Core Alliance. And so far, we have how many attendees? 60 attendees. Can we give a round of applause for each and everyone? We can use our chat box to begin with, all right? As I was saying, guys, we are very, very fortunate for today's product training because the training that is going to happen is coming from a medical doctor by profession, Doctora Raschel Maguera. Okay, she is a training specialist, product training specialist, and I believe everyone is ready. Doctora, are you ready?
Yes.
All right. I can just make you a host first. Just a minute, co-host, so that you can share your screen later on. All right, everyone, without further ado, can we give a virtual clap for Doctora Raschel Maguera?
Okay, so good morning to each and every one of you. So once again, thank you for inviting me to conduct this product training in your group. But wait, I'm just trying to look for my slide. Okay, just wait for a minute. Okay, okay, where's my slide? Okay, so that's it. Okay, so let me share with you my slide right now. Okay. Okay, can you see my slide now, Coach Myla? Okay. Okay, so again, welcome to our product training for tonight. So welcome to Empowered Consumerism, which is fueled by Alliance in Motion Global. By the way, there's still some of you who doesn't muted their mic so that we will be able to clearly hear our discussion for tonight. Okay, thank you very much. Okay, so later on after our training, we will be having a question and answer portion with regards to our product. Okay, so for those who are first time going to be seeing me right now, I'm Dr. Rochelle Manguera. I'm one of the product trainer of our company. That's why we are discussing tonight our products, because one way of earning here in Empowered Consumerism, which is fueled by, again, Alliance in Motion Global, is through selling and sharing, of course, our products. And of course, it is so hard for us to share these products if you don't know properly for what are these products are, for what are these products for, and how to use it. So that we will be discussing for tonight. But I will be discussing just a few of our products because we have so many products, so we cannot discuss it in one sitting. So we will be having a sets of session with regards to our product training. Also, I'm part of the training specialist where also we're discussing different topics. But for now, my topic for you is all about our products. Okay, so let's start. Okay, so uh-huh. Okay, so all the products here in Alliance Emotion Global are actually made by world-class partners. So they are the manufacturers of our products. So as you can see here, Nature's Way is a billion-dollar company, and the DSM company is also a multi-billion euro company, and the AMS is also a multi-billion yen company. And just imagine the Wither company, which is also a billion-dollar company. So as you can see here, these companies are really big companies and all international pharmaceutical companies. And what's nice about that, they trusted the company because of the good credibility standing of our company. And not only that, just imagine those products that were given to our company, we are the exclusive distributor of these products worldwide, meaning there's no other way that these people around the world will be getting these products only from you. it means that it will be a great earning opportunity for you because no one will be able to sell these products only here in Empower Consumerism, again, which is fueled by Alliance in Motion Global. And aside from that also, as you can see here, that I think everybody would be agreeing with me that health is wealth. And since this is health is really being taking care of our body, so just imagine all you have to do is to eat healthy foods for us to be wealthy as well. And aside from that, okay, so it's also said here that let's keep our health to enjoy our wealth. Even though if you are blessed in this world with so much blessing, but if you are not healthy, you will not be enjoying this wealth. But imagine here in Empowering Consumerism, this health and wealth that we are talking about is both can be given by our company. Yes, it is. But before we start discussing our products, let's first discuss these free radicals. Okay, so what are these free radicals? Actually, these free radicals have a simple job in our body, and what is that? To keep you unhealthy. It means that it can give diseases in our body. But the fact is, this free radicals is being made by our own cells. Yes, it is. So how does it happen, doctor? Oh, okay. So just imagine these cells of ours. I hope you do still remember the cells that are being discussed in school. Okay, so these cells of ours, one of its function is to produce energy. But aside from producing this energy, one also of the byproducts of this producing energy in our body is that it can also be producing free radicals. So whether you like it or not, we do have so many free radicals in our body. Yes, and the thing is, again, there are so many other free radicals coming from outside your body. So where can we get these free radicals outside from our body? So just imagine the processed food that we are eating outside our house. They are also have free radicals and the stress, and there are so many kinds of stress right now, the mental stress, physical stress. So just imagine there's so many stress people right now in the whole world because of this pandemic that we're having because of this coronavirus. Aside from that, the pollutions coming from air, water, and chemical as well also can contribute free radicals to our body. Aside from that, the unhealthy lifestyle that we are doing every day. So what are some of this unhealthy lifestyle that we are doing? Okay, drinking alcohol is one. Okay, so drinking alcohol is good for the body. Yes, it is. But it is said that just drink moderately, because if you drink too much, if you do have so much alcohol in your body, it can also cause diseases to our body as well. And this, of course, smoking. So if the alcohol, we can drink it moderately, but the smoking is really not good for our body. So just imagine just a puff of cigarette can contribute to our body 1 million free radicals. So just imagine one stick of cigarette cannot be consumed in one puff only. So meaning you can get millions and millions and millions of free radicals just by simply smoking one cigarette. So just imagine some people will be can consume 20 sticks per day, 40 sticks per day. So just imagine there are a lot of free radicals to that, and also a lot of diseases as well. So those who are smoking out there, so I advise as a doctor, it might be good if you do gradually stop using the cigarettes. Okay, so not only that, because some people also might get sick because of you, because of the smoke that you are throwing to them. It's each and every time that you are smoking, so it's really not good for our body. Okay, so where do we get this diseases as well? So we can also get some diseases through what we call pathogens. Okay, what are pathogens? Actually, these pathogens are those bacteria, viruses, and the microorganisms that cause diseases in our body. And of course, the very famous COVID coronavirus that causes the COVID-19 pandemic that we're having right now. It's also the biggest stress that we have right now in the whole world. And of course, let's now discuss our body. Okay, just imagine our body composed of different systems like muscular system, digestive system, circulatory system, and many other systems. So each and every system composed of organs, tissues, and cells. So just imagine if these cells of ours are being exposed to these free radicals. So just imagine to this pathogen. So what will happen to our cells? Of course, it will be damaged. It can get sick, and not only that, it may die as well. So when it happens, there will be a chain reaction, and what will be that? So these tissues also might get damaged, these organs, the systems. The question is, does our body still healthy with that? Of course not. So we have to combat these free radicals and pathogens. How? So we have to have a strong immune system. And this immune system is the one responsible in our body for you to stay healthy. And not only that, if you do got sick. So just imagine if you do got sick from simple colds to serious diseases such as cancer. So just imagine you will be able to heal yourself in a faster way if you do have a strong immune system. And how can we have a strong immune system? Just by simply taking more antioxidants. Actually, these antioxidants are specific nutrients that we can get from different foods. Okay, so what are the benefits that we can get from these antioxidants? First and foremost, it can prevent or slows down the oxidative damages to our cells. So just imagine, aside from that, it can also delay the aging process. It also acts as a free radical scavenger. And not only that, it also prevents and imagine repair the damages that have been done to our cells by these free radicals. And where can we get these antioxidants? In different phytonutrients. And as you can see here on the left, on the right side of our slide, this is actually an experiment done in our cells. So just imagine these are human cells and they are exposed to digested products from a typical fast food meal. So as you can see here, there are so many cells that has been damaged because of this digested products coming from this fast food meal. But just imagine the cells of ours were exposed to what we call antioxidants. So as you can see here, there's just a few of our cells have been damaged because of the protection that has been given by this antioxidants. So in this experiment, it is well said that these antioxidants are really good in our body. And the WHO actually recommended us, not only the WHO, the National Cancer Institute, the American Dietetic Association as well, that we human at least can consume, should at least consume 5 kinds of fruits and 5 kinds of vegetable each and every day. But the question is, do you? Do you consume these 5 fruits and 5 vegetables? Of course not. Most of us actually doesn't eat this 5 fruits and 5 vegetables. And the W also knew that, so they were the only they also recommended us just to take this food supplement as a solution for that. Why? Because if we do take this food supplements, it is as if that we are eating this 5 fruits and vegetables, because most of this food supplement contains fruits and vegetables. And aside from that, it is also said that prevention is better than cure. Why? Because getting sick nowadays is really so expensive. And not only that it is expensive, it also would be very stressful for us, because if you do get sick, you're stressed, your family is stressed. So just imagine nowadays, even if you just have a simple fever, just imagine everybody is being stressed. Why? Because everybody's thinking that you are having this coronavirus. Okay, so let's now talk about our products, and we are very fortunate here in empowered consumerism. Why? Because we have a wide range of products wherein we can really make your body to have a strong immune system. So now let's discuss this nutritional support product of ours. So let's start with our C24/7. Okay, actually the C24/7 contains approximately 22,000 phytonutrients. As you recall earlier, that the antioxidants, where can we get these antioxidants? From this phytonutrients. And just imagine, this 22,000 is not a simple number. It is really a lot of phytonutrients that we can get from this C24/7. Okay, so what does C stands for in our C24/7? Actually, C stands for cellular. Why? Because if you do take our C24/7, the nutrients of the C24/7 can get up to the cellular level of our body. So that's why it is said here that it can give our cells protection, immunity, energize, enhancement, support, nourishment, cardio protection, and even cancer protection for 24 hours a day, 7 days a week. Yes, that's the beauty of using our C24/7. So how does the C24/7 do that? All things, because again, it contains the 22,000 phytonutrients. And where this 22,000 phytonutrients came from? Of course, it contains 29 vitamins, minerals, and trace minerals from vitamin A to Z that can increase our immune system. So just imagine 29 vitamins, minerals, and trace minerals. So you cannot get all these vitamins and minerals with the other food supplements in the market right now, only in our C24/7. And aside from that, it also contains the 12 whole fruit juice blend and the 12 whole vegetable blend that can detoxify our body. Okay, so what do we mean by detoxify? Detoxify means cleansing our body. So just imagine, just by simply using this our C24/7, our body can be cleansed. So just imagine if you do take this C24/7 of us. So just imagine you will be able to cleanse our body each and every day. So you can assure that your body will be cleansed each and every day, and thus our body should be cleansed every day, of course. So all you have to do again is to again take our C24/7. Okay, so aside from this, so what do we have here in our C24/7? It also contains the 18 amino acids. Okay, these amino acids actually are the building blocks of protein. Actually, it promotes faster wound healing. So what do we mean by building blocks? So it composes the protein in our body. So what are the body parts of ours that composed of proteins? First and foremost, our muscle. Do we need our muscles? Of course. If you don't have our muscles, of course, how can you be able to move our body? So aside from that, hemoglobin is also actually a protein. Okay, so what is the function of hemoglobin in our body? It's the one carrying oxygen throughout the cells of our body, and this oxygen is very helpful in our body. Why? Because it's the one responsible that making our body to these cells of ours to produce energy as well. And aside from that, what are the other proteins in our body? Okay, digestive enzymes. So what are the function of these digestive enzymes? They are the one breaking down the foods that you are eating each and every day. Okay, aside from that, antibodies are also proteins. So what is the function of these antibodies? Okay, actually, these antibodies is one of those helping our body to combat, to destroy these microorganisms that comes into our body, because they will be causing diseases as well in our body. So just imagine these things that I was able to discuss about proteins is that this muscles, this hemoglobin, what else? These antibodies again. So what are the other things? So uh, hemoglobin, digestive enzymes, antibodies, muscles, or protein cannot be produced without these amino acids. And we are very fortunate that our C24/7 contains this 18 amino acids. Okay, so aside from that, it also contains the 14 super green foods and spirulina blend. So what does this 14 super green foods do to our body? Actually, this 14 super green foods and spirulina blend, actually they are plants. These plants actually are specialized grasses. Actually, some of them are mosses, which can be seen under the sea. Okay, so actually, this super green foods and spirulina blend contains this what we call chlorophyll. Okay, so what is chlorophyll? They are the one responsible giving yellow and green color to our plants. Okay, so if this chlorophyll is already inside our body, it can it can increase your hemoglobin. Again, so what is the function of hemoglobin? As I said earlier, that this hemoglobin is the one carrying oxygen to each and every cells of ours so that the cells of ours can be functional. Okay, so aside from that, of course, it means that there are a lot of oxygen that can be delivered to our cells as well. Okay, so aside from that, it also contains 12 mushrooms. Actually, these mushrooms helps prevent cancer of any origin, but not only prevent, but it can also cure cancer. And just imagine, for the past 14 years, we have so many testimonies with regards to RC24/7, even in cancer patients. So I have here one testimonies which I was able to get in one of our magazine here in Empower Consumerism, that this patient actually was diagnosed to have a laryngeal cancer. So this is a cancer of the larynx. Okay, so actually this patient undergoes chemotherapy and expensive treatment as well, but to no avail of these things. But one of our distributor was able to introduce our C24/7 to this patient, and actually he actually uses or take 3 capsules a day. So after 3 months of using RC24/7, his laryngoscopy was repeated, and just imagine God's miracle. So he was cleared already from his cancer, and just imagine even his oncologist. These oncologists, actually, they are the doctors which are specialized in cancer patients. Even the oncologist of this patient was able to amaze with our product, and also get our was able also to be part of empowering consumerism because of the beauty of our product. So just imagine this testimony that I'm telling you is just one of the testimonies that we have in the use of our with the use of our C24/7. As I said earlier, for the past 14 years, we have so many testimonies with the use of our C24/7. And aside from that, this C24/7 also contains 12 digestive enzymes that enhances and balances our metabolism. As I said earlier, that this digestive enzymes is the one breaking down the foods that we are eating each and every day. So if there are so many digestive enzymes, meaning the nutrients will also be fasterly be absorbed by this digestive by our intestine, and also be faster be delivered to our body, so we can get also be healthy in a faster way if we do use our C24/7. Okay, aside from that, it also contains 12 herbs and specialty nutrients. Actually, these are specialized berries. Actually, these berries enhances our sexual vitality. There are some people that they don't know that they have problems in their body unless it's also it has already a side effect in our body. So one of which is what we call the hormonal imbalances. And actually, this hormonal imbalances doesn't come only in women but also comes in men. So what would be the side effect of this is you cannot conceive your baby. So just imagine one of our testimony here in the Philippines is that this couple was married already for the past 16 years. So just imagine, for the past 16 years, so they are consulting their doctors, they're having medical treatments as well, but to no avail of this treatment. But just imagine also, some of our distributor was able to introduce our product, our C24/7, to them, and was able to use our product. And just imagine, after 16 years of waiting for their baby, they were blessed to have their baby just by simply using our C24/7. Okay, aside from that, it also contains the 10 essential fatty acids. Actually, what is the functions of these fatty acids in our body? It can controls our high blood pressure, also lowers down the bad cholesterol level in our body. Also, it protects against heart diseases and its complications, and also promotes healthy blood circulation as well. So these are the functions of the fatty acids that comes from this flax seeds and sunflower seeds. But aside from this, fatty acids, actually, this flax seeds actually also produces what we call okay, so what we call the lignans. Okay, so can you say lignans? Lignans. Okay, so what are these lignans? Actually, these lignans are substances wherein it can, okay, take note, it can actually prevent a new growth or what we call tumors in our body. So it is so important that we use our C24/7 to prevent us from having tumors as well. So don't wait for your body to get these tumors first before we try our C24/7, because again, prevention is better than cure. Of course, we also have here the 5 anti-aging and antioxidant enhancer, wherein it can also increases the production of glutathione in our body. So glutathione is naturally produced by our liver. And aside from that, it also rejuvenates the skin so that you will also be staying looking young each and every day. It also regenerates our liver cells. So we have the liver of ours have so many functions. So we have to take care of this liver of ours. One way to do that is, of course, using our C24/7. And aside from this 5 anti-aging, it also contains the 4 longevity Filipinos. And the longevity Filipinos that we have here in our C24/7 is what we call the mega resveratrol blend, wherein it can prolongs our life. Okay, so each and every one of us that do wants that, of course, yes. So one way to do that again is to use our C24/7. If we do add this ingredients of our C24/7, just imagine you will be having 140 ingredients, 140 formulation of our C24/7. So just imagine, these products of ours are really good in our body, okay? But aside from that, it also uses different kinds of technology. So what are this technology? So it uses what we call the phytoalkatech, wherein it is placed with the alkaline-based formulation so that it can have the nutrition of our C24/7 will be protected and normalize possible acid damage, preventing preserving high potency and purity, meaning all the nutrients will be absorbed by our digestive system because of the protection that we have because of the alkaline based formulation. And aside from that, it also uses what we call the signer technology, wherein just imagine the C24/7 of ours composed of 140 ingredients. So it will not affect each and everyone, but just imagine it will be having a complementary and synergistic effect. Why? Because this actually C24/7 is being formulated by 200 medical doctors and scientists. They research what are the vitamins, the minerals, what are the other plants that we can get or we can take simultaneously, and we will be having a better effect if we do that. And we call that again a complementary and synergistic effect. And because of the high technology we have right now, so just imagine those 140 components of our C27 was able to be placed in a capsule because of what we call the nanotechnology. And aside from that, the capsule of our C24/7 is also comes from vegetables. So meaning vegetables are very safe in our body. Actually, this is a comparison test where in 4 tablets is being compared and after 15 minutes. So just imagine only the C24/7 was disintegrate after 15 minutes. Meaning if this food supplements is faster to be disintegrate in our body, so meaning these nutrients also will be faster be absorbed by our digestive system, so it can also be delivered in a faster way to our body, meaning we can also be healthy in a faster way as well. So that's the beauty of using our C24/7. And for our next product, we will be discussing our complete. Okay, can you say please complete? Okay, so once again, can you say complete? Okay, so very good. Actually, this is just like our C24/7. Why? So as you can see here, it has the same it almost has the same formulation with our C24/7, but okay, so but C24/7 contains, as I said earlier, 22,000 phytonutrients, but our complete only have the 16,000 phytonutrients. Why? Because it doesn't have what we call the anti-aging and the longevity Filipinos in RC 24/7. That's why it only contains 16,000 fighters. But the other ingredients, actually, they are almost the same. Okay, so why? Because not all customers of ours should be using this anti-aging and longevity Filipinos. So who are those customers of ours who would be using complete better rather than RC 24/7? Okay, so let's discuss it. Okay, so as you can see here, these are the conditions that will not be taking longevity Filipinos like our C24/7 but may take our complete. First and foremost, those who are pregnant. Second, those who are lactating mothers who are having breastfeeding and their babies. So who else? Those females. Okay, if you do have customers and if they have problems with regards to their reproductive system, such as the breast, vagina, cervix, uterus, fallopian tube, ovary, what we are recommending to these patients are complete. Okay, so aside from that, those who are below 80 years old should be using our complete, not the C24/7. Those patients who have blood-related diseases. So, for example, leukemia, anemia, beta thalassemia, those who are diseases that are related to blood will be using the complete as well. Okay, those who, as of the moment, has an active bleeding. Okay, so we will be taking the complete rather than our C24/7. Okay, so those patients who are also having problems with their kidney or liver function as well. Okay, so those patients who are having their maintenance. Okay, take note, maintenance, meaning they are taking this every day. So if they are taking blood thinners, okay, such as aspirin, heparin, warfarin, clopidogrel, so you have to ask your customers, do you take blood thinners as your maintenance each and every day? So if they do have that, you don't recommend RC24/7, but you can recommend R complete. Okay, so those who are also having an autoimmune diseases such as lupus. Okay, so those patients also have thyroid problems, specifically hyperthyroidism. Okay, so those patients also who are taking contraceptive pills may not take RC24/7, but rather than they will be taking R complete. So it is very, very, very important for you to ask these conditions to your customers first before you were able to decide whether you're going to advise the use of our C24/7 or the use of our complete. If you do have a camera on your gadget, so you may take a screenshot of these conditions, so you may be able to recall what are those questions that you should ask to your customers first before you decide whether the C24/7 or complete would be better to your customer. Okay, so if you do advise either the C24/7 or either the complete, you have also to ask your customers if they do have a normal function of their liver and their kidney. So if they say yes, okay, so we will not be having a problem to that. But if your customer said that I don't know the condition of my liver or my kidney, so they may take so what we call the blood test. Okay, so they will be having this blood chemistry. So, but before they take this blood test, of course, they should be having a fasting for 8 to 10 hours. So, they will be tested for their SGPT, that is for their liver function, and creatinine for their kidney. Okay, so once there is a result and that is normal, meaning that they don't have any problems with their liver or their kidney. So, aside from that, the normal results without the conditions that we were able to mention earlier. Okay, so if the result is normal and again without the conditions mentioned earlier, so they may take our C24/7 and all the other products. Okay, so how they may take them? They may take that maximum of one capsule 3 times a day. So they may take it once, twice, or thrice. So 30 minutes before meal or 2 hours after meal. So why different dosages? So it depends upon the budget of your customers. Okay, so if they have the budget of just taking one capsule a day, so it would be fine. But if they would be taking two capsules per day, of course, they will be healthier. But of course, if they will be taking it three times a day, they will be, of course, healthier than those who are taking the two capsules per day. Okay, but if they're sick, of course, they should have a higher antioxidants level in their body, so they may take a higher dose of our product. So they may use it two in the morning, two in the afternoon, and two in the evening. But if we are talking about tumors, cysts, cancers, so they may take it three capsules three times a day. But take note, okay, if they will be taking the three capsules a day, six or the nine capsules a day, kindly monitor their body if they can tolerate that high dosage at once. Why? Because some customers, if they do take the higher dose at once, they have some a bad effect on their body. So they felt something about using the that high dosage at once, such as headache, palpitations, nausea, vomiting. There are so many other signs and symptoms that they may be able to feel upon the use of a high dosage. So if they do felt something or bad in taking the high dosage at once, it means that their body cannot tolerate the high dosage. So what we are going to do, on the first week of taking our product, they may just use it once a day. Okay, on the following week, they may increase it to two times a day. On the third week, three times a day. So as long as they may be able to take or tolerate the dosage, so that would be fine for them. But there are some also instances that some of the customers may take it, no, may take the three capsules three times a day, but they don't felt bad about it. So meaning their body can continuously use that dosage because their body was able to tolerate that high dosage at once. We are just going to follow this algorithm if they do have they felt something bad upon the use of a high dosage at once. Okay, so what we are talking here right now is that they have a normal result of their kidney and their liver function, and they don't have the conditions that was mentioned earlier. What if, okay, so take note, what if the result of this SGPT and creatinine is high, meaning that they have problems with their kidney or to their liver. So if they have a high result of their creatinine or SGPT, of course, we will be using the complete. And aside from that, we will not be advising them the use of a high dosage at once. We will be just starting once a day. And after 2 weeks, if they are able, if they have the means of repeating the test, so just imagine those tests only that have a high result should be repeated. But just imagine if the creatinine and SGPT is high, both of them, we will be repeating both of them. But in case that just one of this is high, that's the only test that will be repeated after 2 weeks. Okay, so after 2 weeks, so just imagine it decreases. So decreasing the result, meaning they were able to their body was able to compensate with the use of our complete. So they felt better upon the using of our complete. So we will be increasing the dosage from once a day to two times a day. Okay, and after 2 weeks, we will be repeating the test again. So if it decreases again, so again, they felt better upon the use of our product. So we will be advising them the use of three capsules a day. But that will be the maximum dosage that we can give if they do have an increased creatinine or SGPT with their result. But there are some instances that may happen like this. So from once a day, we will be increasing it to two times a day if it decreases. And after repeating the test, it increases again. So meaning that their body can only consume once a day. So aside from that, this may also happen. So if it increased on the first time, so we will be using the once a day. And after 2 weeks, upon the repeat of the test, it increases again. So we can still continue the use of our product once a day for 2 weeks. And after repeating the test, that's the time that the result decreases. So meaning that their body can only consume the once a day dosage. But there are some times that may have a situation like this wherein it doesn't decreases. So just imagine if the test continuously to be increased, meaning, take note, meaning if they do have this situation, meaning that their liver and kidneys are not functioning well anymore. So we will be advising them to stop the use of the product. So take note, the product doesn't have a problem with this. So their body, their kidney and the liver is the one who have a problem in this and not our product. Okay, so what are we going to advise to this customer? So they will be stopping, they should stop their suffer complete, but we may advise, okay, but we may advise the use of our white light. So actually this white light is the first sublingual glutathione in the market. So as you recall earlier that I told you that this glutathione is naturally produced by our liver. So this glutathione is very safe for our body because this is naturally produced. So what are we going to do with this white light is that we are adding this glutathione in our body. By the way, so what is the function of glutathione in our body? Yes, others may just recall this glutathione as giving us a fairer complexion, right? But aside from that, the main function actually of glutathione it is that it is a detoxifier. Again, so when we say detoxifier, that is cleansing our body, and not only that, it is also a very potent antioxidant. So as you recall earlier that I told you that antioxidants making our body to have a stronger immune system. Okay, so what's nice about again this white light, this is actually the world's first sublingual that is not being ingested, but instead you just have to spray this white light under your tongue. But before that, you have to shake first the bottle. You have to spray under the tongue, 3 puffs. Okay, so 3 sprays under your tongue, close the mouth, don't swallow it. So hold for 20 seconds up to 1 minute. Then you can swallow it, after which you can repeat the spray every 4 hours, 3 to 4 times a day. So again, it would be safer for them to use the complete and also the white light simultaneously if the budget permits. But for those who have having budget problem with their budget, they may start first with our complete. But as you recall earlier that the laboratory test tends to get increased each and every time that we repeat the test, you have to stop the use of a complete, but you can recommend our white light even if your creatinine or SGPT continuously to get higher. This white light will be safe for our patient. And aside from this white light, actually we may also use the advise them the use of our ultra H2 as well, our C supreme as well, because they are all safe in our body even if you do have an increased creatinine or an increased SGPT. Okay, so as you recall earlier, so we just have to review it. Okay, so these conditions again may not use those products of ours with longevity polyphenol. So they may take our complete. So what are the other products here in Empower Consumerism that contains longevity polyphenols that we may not advise to use with these patients of ours? First and foremost, the C24/7, the Restore Life, the Burn products, the Perfect White, and the Vitamax. So if you were able to see these conditions of your customers, you will not also be advising them the use of these products because they all contains longevity polyphenol. So again, it is also very important for you to ask again these conditions to your customers before you decide whether you're going to give the C24/7 or are complete and these other products as well. Okay, so aside from that, of course, if you were able to decide already, whether the C24/7 or complete will be good to your to your customer. So the next thing to ask is, how many am I going to give with this customer of mine? Of course, again, if they are normal, if they are not sick, so they may use up to 3 times a day. Okay, but if they have kidney or liver problems, so the maximum dosage would be 3 capsules a day. But for other diseases and they don't have any problems with their kidney or liver, they may take it on a higher dose, 6 capsules a day. For those cancers, tumors, cysts, so they may take 3 capsules 3 times a day. So again, 30 minutes before meal or 2 hours after meal. But for those who are taking the Restore Life, okay, so those who are taking Restore Life, they may just take it again for maximum of 2 capsules per day. Why? Because, okay, if they, okay, by the way, if your customers are already using 8 capsules of the C24/7, you may not advise them the use of our Restore Life. Why? Because 1 capsule of our Restore Life, again, 1 capsule of our Restore Life actually equivalents to 4 capsules of our C24/7 with regards to the resveratrol component of our C24/7. So if your customers again is using the 8 capsules per day, you may not advise them the use of our Restore Life because they are already consuming the 2 capsules of our Restore Life with that already. And for those, okay, and for those who are pregnant and lactating mothers, they may take our Use My Choco, and we may add this, no, the Ultra H2 water, and of course our C24/7. But for those who are having cardiovascular diseases with blood thinning, so again, what are those blood thinning medicines? Clopidogrel, heparin, aspirin, Coumadin, warfarin. So if they're taking that, again, they may use the complete or our Colidose. But for those who have cardiovascular diseases and they're not using this blood thinners, you may advise those of our C24/7, Restore Life, Colidose as well. Okay, so of course, we adults should be healthy. Our children should also be healthy as well. And we have good products here in Alliance in Motion Global. Okay, the what we call the Kiddie 24/7. Actually, this is a Nutrigummy candy. So it's a candy which is very soft, and it's individually wrapped. So you can give this to your children 3 times a day. So maximum of 3 times a day. So what does this Kiddie 24/7 contains? Actually, it contains 14 essential vitamins and minerals. And just imagine these vitamins and minerals are usually given to our children in syrup form, but we are really having a hard time in making them drink these syrups. So just imagine children are very fond of eating candy, so you will not be having a hard time for them taking these vitamins and minerals because they do love these candies. And aside from these 14 vitamins and minerals, it also contains the 26 fruits and vegetables. So as you recall earlier, the WHO, the American Cancer Society. So just imagine they advised us to at least consume 5 fruits and 5 vegetables each and every day. But just imagine our C24/7 contains how many? 12 fruits and vegetables, 12 fruits and vegetables, 12 whole fruits vegetable, uh, uh, 12 whole fruit juice blend and 12 whole vegetable blend. But just imagine our Kitty 24/7 contains 26 fruits and vegetables, meaning your children, upon the use also of our Kitty 24/7, will also be healthy upon the use of our Kitty 24/7. So they will really be healthy with the use of our Kiddie 24/7. So what are the other benefits that we can get from this Kiddie 24/7? Actually, it also contains the full vitamin B complex for their growth and thinking skills. Also, it contains vitamin C for their protection and immunity. Also, it can strengthen their teeth and bones. Also, it can provide extra energy, good eyesight as well, and also for better digestion, because there are some children that they are already experiencing this constipation even at a young age. So this Kiddie 24/7 may help them. So just imagine we can get so many benefits from using our Kiddie 24/7 to our children. And aside from that, okay, so that would be the products that we will be discussing as of the moment, because again, as I told you earlier, that we have a lot of products here, but we will not be able to discuss each and every one of them, because we can have another sessions for the other products that we can be discussing uh, after this training of ours. So aside from that, as I said earlier, as I promised, that after our training, we can have a question and answer portion. So as of now, actually, we can actually, for those who are having questions, so you may chat here in our chat room, or you may unmute your mic so that we can hear your questions with regards to our product. Yes, Coach Myla.
All right. Thank you so much, Dr. Raschel Maguera. Can we give a virtual clap for our doctors for tonight? Okay, so for those people who have questions, this is our opportunity, guys. We don't do this much here in UAE. Actually, this is Dr. Rachel's first time, right? Here in UAE, Doctora. Yes.
Yes.
So let's take this opportunity. Let's ask questions. Anything that you would like to ask, let's do it. There's one question privately that has been sent to me.
Okay.
If she can, if she can have the copy of this presentation. So I said that I don't have it. So maybe we can ask Dr. Rachel about it.
Okay, so we have a question here coming from Diamond. Wow, Diamond. Okay. So hi, Doctora. So mga ilang months? So how many months po na pwedeng mag-take ng complete phytoenergizer ang isang nanay na bagong panganak? Okay, so with the use of our complete, okay, so for pregnant women, so we may advise the use of complete, Colidus, what else? My Choco, our C Supreme, and also our Ultra H2 water. Okay, so when it comes to Ultra H2 water, so we don't have any uh, what do you call this? Maximum. So they may use it as many they may drink Ultra H2 water as many as they can. So when it comes to C Supreme, they may take it once a day. Okay, so when it comes to our Colidus and with our complete, okay, so for example, that you are not yet pregnant, so you are using the C24/7, right? Okay, so once you know that you are pregnant already, so you may stop the use of our C24/7. Okay, but you are using also the Colidus. You may use the Colidus continuously even if you got pregnant. Okay, so once you got pregnant, you stop the use of the C24/7 on your, take note, on your 11th week. Okay, so of course, if you got pregnant, you will be having this ultrasound, and you may know how many weeks that you are already having with your baby. So if it's already an 11th week, okay, so that's the only time that you may start the use of her complete. Okay, so why? Because on the first 10 months, there's what we call the organogenesis. So these organs of this baby is being produced, and after the 10th week, so they are already produced, they are already formed. So that's the time that we will be starting the use of complete. But again, the Colidose should be continuously used. Okay, so they may take it up to 3 times a day, the Colidose. Okay, so if they reaches already the 37th week, as I said earlier, you're going to your doctor and you are having this ultrasound, so you may know how many weeks that you are having already. If you're already on your 37th week, so you may stop the use of our Colidus and the use of our complete. Why? Because actually these products of ours has a vasodilating effect in our blood vessels. Okay, so why 37th week? Because the normal delivery of pregnant women is 37th week up to 40th week. So once you delivered your baby and the bleeding stops already, that's the time that you may continue the use of our complete and Colidus as well. Okay, so you may take the Colidus continuously even if you got pregnant. If you're using C24/7 and you got pregnant, of course you have to stop it. And then your 11th week, you may start the use of our complete once a day. You may continue using a Fercolidus and complete up to the 37th week. Once you delivered your baby and you're no longer having this bleeding, so you may continuously use the complete and the Colidose as well. Okay, so for our next question here, uh-huh. Okay, so the next question here is, Doctora, how about leukemia, 12 years old? Okay, actually for 18 years old and below, so 12 years old up to 17 years old, we may advise the use of complete. Okay, so complete once a day only. Okay, so once a day only for 12 years old and up to 18 years old. Okay, so actually as I'm always telling to my training that our products, take note, okay, so our products are not drugs that treats any diseases. So why are there so many testimonies with the use of our product? Because as I said at the start of our training, that these products of ours can increase our immune system, and that is the one responsible in making you, helping you, support you with the diseases that you have. But actually it doesn't cure any diseases, but in cases, so those that I was able to mention you earlier, there are just some conditions that may not use our C24/7 or those products of ours that contains longevity polyphenols. So as you recall earlier, that if we do have conditions, blood-related diseases such as this, leukemia, we may use our product complete. And aside from the complete, you may also advise this child to take also our Ultra H2 water. And this child also may use our C Supreme as well once a day only. Okay, so they may use those products. Even the Colidus, he may take it also once a day. But if the budget permits, they may use all that. But if there's a restriction with regards to their budget, they may just use our complete. Okay, so we will be just advising the use of our complete once a day in this child with leukemia. Okay, so the next question here is that considering the products explanation, especially those related to food supplements, we should, okay, so I don't know what's the question here. Okay, so the next question, hi, Doctora, complete 24/7, pwede po ba i-take ng may gastro acid reflux problem? So parang ano to, no? Complete C 24/7. Okay. So either the complete or C 24/7 may use or may use even if they have gastroesophageal reflux disease. Actually, this acid reflux problem, they may use actually in GERD. So actually, this is a GERD. So gastroesophageal reflux disease. Actually, this is an anatomical problem. Okay, so the esophagus and the stomach, it has a sphincter that should be closing, but because that this sphincter is already lax already, so the muscles doesn't the sphincter doesn't close properly, so there is an acid reflux. So we may also advise in this patient that this patient, okay, so this patient must actually have a small frequent eating. So when we say small, so this patient should not be eating that much in one sitting. So why? Because again, the sphincter doesn't close properly. So if your stomach is full of food, of course there will be contraction and there will be a possibility of acid reflux if he has a full stomach. So a small frequent feeding should be taken by this patient. Aside from our product, of course, complete or either the C24/7. Again, you should ask first those conditions that I mentioned earlier before you decide whether the complete or the C24/7 may use with this patient. Of course, there's some gastroesophageal reflux that there's already ulceration, bleeding. So in case that there's bleeding, we may use the complete, not our C24/7. Okay, Doc, ano po ang maganda i-take ng mayroong almoranas? Okay, so what is almoranas? Hemorrhoids, no? Okay, if they have hemorrhoids. Okay, so actually, if you do have hemorrhoids, so it depends upon the grading of your hemorrhoids. If this hemorrhoids is already have bleeding, okay, take note, bleeding. Again, we may use the complete. But if there is already profuse bleeding, you should go to your surgeon for these hemorrhoids to be taken out to your body, because you may, okay, so may you have deplete your red blood cells, your blood, if you do continuously ignore the bleeding of your hemorrhoid. So if again there's bleeding, profuse bleeding, you may go to your doctor for you to undergo already the surgery. Of course, again, if you do have bleeding already with your hemorrhoids, so again, complete would be better. So rather than our C24/7, and of course, what else? C Supreme, Ultra H2 water may also help. But again, our priority always is the flagship product, either the complete or our C24/7. Okay, God bless Doctora. Craniopharyngioma. Okay, so a 19-year-old. So again, if this 19-year-old have this craniopharyngioma, okay, so again, ask those conditions first that I mentioned earlier, because again, even if your customers have this different conditions, if they have those conditions that I mentioned earlier, that they should not be using those products with longevity polyphenols, you may advise the use of our complete. Okay, so again, so if this is a cancer patient, okay, so we will be advising, of course, the use of 3 capsules 3 times a day. But again, before you advise the use of high dose, you may have to take first to ask first if the liver and the kidney are functioning well. Because if this patient also have a problem with their liver and his kidney, we cannot advise the use of a high dosage with this patient. So we may observe. So we may just start the use of once a day with this patient if he will be having or she will be having a high creatinine or SGPT with regards to his laboratory. So this patient again should have a laboratory with creatinine for the kidney and liver SGPT. So we may decide whether she or he can take a higher dose of our product. Okay, of course, how can we be able to know if your customers are progressing or having help by our product? Of course, this ultrasound should be repeated. It's the decision of the patient whether on when or he when he going to do again his ultrasound after using our product. So I think 3 months would be fine, but not 1 month. Okay, so either 2 months, 3 months, or 6 months. So it would be depend upon this customer whether when he is going to repeat his ultrasound for us to know if the craniopharyngioma is uh, um, decreasing in size. Okay. So for diabetic persons na may schedule for dialysis, ano po ang dapat niya inumin? Yung C27 po ba or complete? Again, as you recall, as I mentioned, for those who are kidney problems, okay, for those who are kidney problems like this one, so the patient will be undergoing dialysis, meaning that his kidney is really not functioning that well anymore, and we will be advising the use of our complete, but again, we will just be advising once a day. So upon the repeat of the creatinine, we will be able to see whether the creatinine decreases or it increases. So it would depend upon the response of his body with the use of our complete. But in case that it continuously to increase, and increase, so again, we should be stop the use of our complete. But aside from the complete, the safest product for this patient who are undergoing dialysis is white light again. So what else? The Ultra H2 water. And we have so many testimonies with our Ultra H2 water with regards to patients who are undergoing dialysis. So we have a lot of testimonies again. But again, this Ultra H2 water is not only only for patients who are undergoing dialysis, but also for other diseases as well. Okay, so as in my trainings, I am actually discussing different there are so many clinical studies, actually thousands of diseases have been helped with the hydrogen rich water which is being produced by our ultra H2 water. So again, the safest product for our patients who are having dialysis, again, once a day of complete, we will repeat the creatinine. If it improves, we may advise that 2 times a day, up to 3 times a day, depending on the response of his body with regards to the creatinine level. And again, the safest, even if the creatinine is getting increases, is the white light and the ultra H2 water. So you may also use the once a day of our C Supreme. Okay, so for those, okay, so for our next question, pwede po bang inumin ng C24/7 kahit wala pang sakit, sakit yung normal po? Okay, so actually these products of ours is not being used by those who are sick only. So we are also promoting hair prevention. So it's better for you not to get sick, and for you to be able to maintain your health. And of course, is using our food supplements. Okay, so you may use our product again, not just because you're sick, but we are also promoting here prevention. Actually, we have one. Actually, I've met one of our distributor wherein he consumes, just imagine, 3 capsules 3 times a day for C24/7. And I asked him, "Are you sick, sir?" "No, I just want to maintain my health each and every day." Wow! Just imagine, he's not sick but consuming 3 capsules of C24/7 3 times a day, meaning 9 capsules a day, even if he is not sick, because he wanted to maintain his health. Yes, you may also do that if the budget permits, of course. Okay, so next question here is that, okay, so, uh-huh, uh-huh. Okay, so for those patients who are having a high cholesterol level, of course, they may use our Colidose. Okay, so the Colidose may be taken safely up to 3 soft gels per day. And for those who are having high blood sugar, of course, they may also use our Restore Life aside from our C24/7. But again, be sure, because those patients who are diabetic, some of them may have affected already their kidneys. So make sure first that these customers of yours has still a normal function of their kidney before you advise the use of our Restore Life and the use of our C24/7. Because if they do have a high creatinine, because their kidney function is not that well anymore, you may just advise the use of our complete white light, okay, ultra H2 water, C Supreme, or Colidose as well. Okay, don't give those products with longevity Filipinos such as C24/7, Restore Life, Perfect products, so Burn products, so Vida products as well. So if they have liver or kidney problems and the other conditions that I mentioned earlier, don't give these products to them. Okay, so for our next question here, again, I was able to discuss already. If they are diabetic, if they don't have problems with their kidney, you may advise the C24/7 Restore Life. Okay, but if they don't have if they have a high creatinine, okay, and also the SGPT, you may not advise the C24/7 for your diabetic patient. Okay, doc, pwede ba i-take my maintenance like perindropil, arginine, 5 milligram, or complete, or C24/7? Again, ask this drugs whether it's blood thinner, because again, if this drug is a blood thinner, so let me take, okay, perindopril. Okay, actually, this is a antihypertensive drug. Okay, again, what are we just going to ask is the maintenance of a blood thinner. If your customer doesn't use any blood thinner or the contraceptive pills, you may advise the C24/7. But again, if they have the blood thinner as their maintenance, again, aspirin, clopidogrel, warfarin, Coumadin, we will not be advising the C24/7. You may advise the use of our complete and once a day only of our Coledus. You may also add here the C Supreme once a day. And of course, our ultra H2 water, white light would also be fine with this patient of ours. Okay, for next question. Okay, so I have a friend. Uh his wife, her wife had a severe cold that affected the vocal cords and the brain, lost speech, and now she's taking speech session. Is there any effective product for her condition? Okay, our products may help again, but we're not promising anything. So for this, so we may advise also the use of our Colidus because our Colidus has contains the DHA. For your information, guys, the 30% of our brain contains DHA, especially the gray matter part of our brain. Okay, so this may help. So she may take three soft gels a day of our Colidus. Aside from that, also our C Supreme, he may take it up to 2 times a day. Why not? And aside from that, Restore Life as well. Again, we may not advise the use of a Restore Life if these patients have those conditions I mentioned earlier. So you have first to ask those conditions before you recommend a Restore Life. But again, the safest product for this is Colidus C Supreme. If again, without those conditions, you may add the Restore Life. And aside from that, also either the complete or the C24/7 may also help this patient. Again, safe, white light, and ultra H2 water as well. Okay, so Doktora, sa may dialysis na person, nag-take na po siya ng 2 boxes of C24/7 dahil yun po yung sinabi sa akin ng nag-invite sa akin. Okay, kaya nga isi-shift natin if you do give this C24/7. Actually, I'm also having testimonies with the use of our C24/7 for those who are having dialysis. They improve also. But again, to prevent, okay, so to prevent the risk of further damage of the kidney because of the resveratrol, we are not advising the C24/7. So you may shift this from C24/7 to complete. Okay, just once a day and not a higher dose of once a day. If the creatinine decreases, we may add the dosage of 2 times a day up to 3 times a day if it decreases. But if it increases, stop even the complete. Continuously should be used white light and ultra H2 water. So that will be safe for our patient. Okay, so Doc, another question po, help. Hehe, pwede po bang mag-take ng burn slim ang may almoranas? Kasi po mataba siya, gusto niya pong pumayat. Kaya lang kasi po yung burn products natin, may longevity filipinos po kasi yan. Meron po kasi siyang vasodilating effect, may blood thinning effect po siya. Kapag may almoranas po siya, then the hemorrhoids may also cause bleeding already. So burn products would also not be good if there is already a bleeding with the hemorrhoids of this patient. Okay, pero if wala, so why not? He may use our burn slim. Okay, so ano po ulit, Doc, pag diabetic, hindi recommend ang C24/7? Pwede, kung sabi ko nga, okay pa ang function ng kidney at saka ng liver niya. Pero kung hindi na normal, complete po tayo, ha? Okay, so in diabetic patient, okay. Okay, in diabetic patient, if your patients have a normal function of their kidney and liver, you may advise C24/7 and Restore Life. But if it has an increased creatinine and SGPT, again, complete white light, ultra H2 water, C Supreme would be good for this patient and not the C24/7. You have said which is the best one with the kidney problem, white light, ultra H2 water. So that is the safest for those who are having kidney problems. So if the creatinine decreases, you may advise the use of complete. So we have just to repeat the test. So we may see if there's a development of decreasing the creatinine upon the use of the complete. But if it increases on the third time, of course, we will stop the use of our complete, and we will be continuously advising the use of white light and ultra H2 water. Okay, so hello, doctor. I have a maintenance of losartan, clopidogrel, atorvastatin. Safe po ba sa akin ang C24/7? Hindi nga, di ba? Okay. Di ba sabi ko kanina, as I said earlier, those who are taking blood thinners, clopidogrel is one of that. Okay, so clopidogrel you may not use. Why? Because clopidogrel has a blood thinning effect. The C24/7, the resveratrol specifically has also a blood thinning effect. If you have so much a blood thinner in your body, you may bleed. So we are not advising the use of the C24/7, but instead the complete. Okay. So you may also the use of our Colidus just once a day. So C Supreme also may help you, white light and ultra H2 water. Okay, so my husband is a frontliner. So para maging maganda po ang immune system niya, pinagtitake ko po siya ng C24/7 and C Supreme. Okay po ba yun? Yes, of course. It may help your husband to have an increased immune system with the use of our product. You may increase it actually up to 3 times a day. Okay, so for our next question here, so anyone can use ultra H2 water, even not sick. I mean, yes, even babies may use our ultra H2 water because this water again has a hydrogen rich water wherein it maintains our health, and not only maintains our health, it also can help so many diseases. As I said earlier, there are thousands of diseases with clinical study. Just imagine, clinical study, this have been proven that helps so many diseases as well since. Okay, so just imagine, as of the 2020, there are thousands already of diseases have been helped with the use of our hydrogen rich water that can also be produced by using our ultra H2. Okay, for those who actually doesn't have a question right now, but if ever that they have a question, they may actually, you may message me personally on my official Facebook account, Raschel Maguera, and also from my fan page, Health Matters. Okay, once I was able to read your question there, I will be responding, replying to your message. So if you don't have questions right now, it is okay. But if you have questions, so you may message me, have a personal message on my FB account. Okay, high blood. Okay, so for high blood, of course, again, of course, either C24/7 or complete. If this patient doesn't take any maintenance for the blood thinners, so you may use actually the C24/7. But if there is a blood thinner as their maintenance, one of their maintenance, so you may advise the complete. Of course, aside from that, you may take also the Colidus if this patient has a blood thinning effect, has a blood thinner as their maintenance, just once a day of the Colidus. But if this patient doesn't have any blood thinning maintenance, he may take the Colidose up to 3 times a day. Okay, so, hi doctor, I have a 86 years old lola. Ano po ang safe na inumin sa kanya? Okay, sabi ko nga kanina, di ba, may mga condition tayo na pwede mo itanong muna sa kanya kung meron siya nung mga yon, o complete tayo. Pero pag wala naman siya doon, pwede naman tayo mag C24/7. Pero kung hindi ka sigurado, pinaka-safe, complete, once a day tayo. Tapos nga, si Supreme once a day, Colidus once a day, white light po, tsaka yung ating ultra H2 water. Yan po yung mga safe na pwede nating advice kay Lola, no? Pero again, tanong mo, kasi kung wala naman, mas maganda syempre yung C24/7, dagdagan mo pa ng Restore Life, no? Okay, so, another question. Hello, Dr. I have yun na nga po yun. Okay, my kids is asthmatic. Ano po yung pwede? So, ilang taon na ba yan? So, 3 years old, kung kaya na mag C24/7, ay mag-complete, why not? Pero kung hindi, candy 24/7 po tayo. Maximum of 3 candies per day, ha? Okay po. So, candy naman kasi yon. So, kakayanin naman po, 3 years old na kung kumakain na ng candy ha. Kung hindi pa kaya, o wag muna, baka mabulunan eh ha. Okay, so for our next question, hello doctor, anong safe na gamot sa anak ko? May bukol sa suso. Okay. So 'di ba sabi ko kanina, pagdating sa when there's conditions regarding reproductive systems of women, okay, we will be advising complete. Okay. So complete. So if the kidney and the liver function is normal, up to 9 capsules a day, pwede po 'yan. So aside from that, again, white light, ultra H2 water, once a day of Colidus as well. Pwede po, no? So, what else here? Okay, so yung 3 years old, tas 11 years old. Yung 11 years old, pwede na po dito yung complete, no? So, 11 years old na eh. So, actually, 12 years old, ina-advise natin. Pero kung kaya na niya, so why not po, no? So, again, para makita, how can we may be able to know if your daughter is improving with his breast tumor is, of course, repeat the ultrasound, the breast ultrasound, maybe after 2 months or 3 months or 6 months. So it would depend upon you when you would like to repeat the ultrasound, the breast ultrasound of your daughter. Okay, so meaning that when in front of customer proposal or any other form of products, information should be more should be more professional specialist as to sure how to direct the proper case. Of course, those conditions that I mentioned earlier, those are the only thing that you have to ask to your customers before you advise either complete or the C 24/7. Again, what are those? Pregnant, breastfeeding mothers, those females who have diseases on their reproductive system, if they have diseases on their breasts, okay, fallopian tube, cervix, vagina, ovary. So what else? Those who are having blood-related diseases, again, such as leukemia, those who have bleeding, okay, those who have hyperthyroidism, those who have kidney or liver problems, those who are taking blood thinners, those who are taking contraceptive pills, those who have having autoimmune diseases. So if you see those cases, complete white light, C Supreme, Colidus, Ultra H2 water would be safe for them. But if they don't have those conditions, C 24/7, you may use that, Restore Life as well. So with regards to the dosage, again, as the function of the kidney and the liver, so you may decide whether you can increase the dosage or not in this customer of yours. Okay, so Doc, question, pag naka-antidepressant, okay, no other form of products information should be more sorry. So the question, naka-antidepressant, okay, and no other underlying issues, ano po ang maganda? Okay, pagka mga ito ano to antidepressant, 'di ba? So syempre ang problema natin diyan sa brain, 'di ba? So pagka sa mga brain pinag-uusapan natin, Restore Life, Colidus, maganda 'yan, no? So yan po yung pwede sa kanila, tapos si Supreme. Pero syempre pwede idagdag din yung ating flagship product, either complete or si 24/7 may also. Pero yung tatlo na yon, ayan. So Colidus, Restore Life, si Supreme, pwede po diyan. Dagdag po natin, priority natin yung complete or yung ating si 24/7 po. Okay, so, hi, Doktora. Ano pa dapat inumin ng kung may, ano ba to? Okay. Okay, varicose veins, no? So, varicose veins, so kapag pag hindi naman yan pumuputok pa, no? Pagka may bleeding na, ay kapag may pumutok po, punta na kagad sa surgeon, ha? So, if this varicose veins bleeds or ruptured, so you may also go to your surgeon already, so for you to undergo a surgery with regards to your varicose veins. But if your varicose vein doesn't rupture, so you may take just either the C 24/7 or complete, because we also have some testimonies with the use of these products of ours that help our patients with varicose veins as well. So high blood, so na-mention na natin yan kanina, no? So doc, last question, kasi yung anak ko po, edad 12 years old, tumaas na po ang kanyang sugar at nagsasag po ang kanyang paa, nagsusugat na po yung kanyang paa. Pinapainom po namin siya ng C24/7. O palitan ko na lang ng complete. Complete po tayo, ha? Complete po. Tapos aside from complete, tingnan mo, check your daughter or your son, if the creatinine is still normal, you may add, okay, so this is 12 years old. So we may not advise yet the restore life in this child. So for 12 years old, again, complete once a day lang po tayo ha. Si Supreme pwede na po sa kanya. So aside from complete once a day, si Supreme once a day, so pwede rin po ito Colidus once a day. So white light hindi pa po pwede, ultra H2 water pwede na po sa kanya ha. Okay. So ayan. O tapos syempre yung bata na to diabetic, 'di ba? So when you do have not only in patients who are young but also in other cases basta diabetic, of course, we should be advising these patients to watch out their diet because the contributive factor that affects the high blood or the high blood sugar in these patients is because of their diet as well. So especially this child, so it is very unfortunate that as young as 12 years old, he is already experiencing high blood sugar. So again, please advise your child to have also to watch out his diet, so not to further. So just imagine if you are diabetic, your kidney will not be functioning that well. So be careful. So if your kidneys are being affected that much, you will be going to dialysis. Even young children may also have dialysis already if they really have a very bad condition of their kidney. Okay, so again, for those who doesn't have questions right now, but if you do have further questions that not mentioned here, you may message me personal, Raschel Dalmasio Maguera, or Health Matters on my fan page for me to address your questions. Okay, Coach Myla.
Yun. Thank you so much, Coach. Ay, Doc, ako po may question. We
Oh,
have
sure.
question, but coming from my friend, his sister got admitted at the hospital here in Abu Dhabi due to, she's in coma now due to
Oh my gosh.
stroke.
Stroke.
Yeah. What can we, which product can we recommend?
Okay, if the stroke, okay, take note, if the stroke is due to bleeding, wherein the blood vessels in the brain ruptures, so we may advise days of our complete, okay, so just once a day of our colidose. But if the stroke happens to be blockage of what do we call this, plaque formation of this cholesterol, we may use actually the C24/7, or we may also advise the Vida Juice or the Vida Max. But then again, if aside from that, the Colidus as well. But then again, if this is due to bleeding, so because of the rupture of the blood vessels, we will not be advising C24/7. Again, complete is the safest. Colidus once a day, so that's all. But if it's not due to bleeding or any rupture, so we may use Vida Juice or Vida Max, Colidus as well, C24/7 as well in this patient.
Okay, Doc. Thank you so much po.
Okay.
How she will be able to take it, Doc? Through ano po, yung sa...
Okay, so that's the thing, because actually you're going to ask a permission with the doctor, but again, of course, most of the doctor, most especially this is in a confined situation wherein the patient is already inside the hospital. Okay, so if the doctor permits for you to give this into the, of course, this patient is in comatose, of course, there's a what we call the nasogastric tube, wherein this tube is being directed into the stomach. So you may pwedeng isabay dun sa mga pinapakain sa kanya, ilalagay dun yung product natin. Pero, yun nga kasi, pag hindi pinayagan ng doktor, yung iba, tinatago nila yung pagbibigay. So, kung merong nakakaalam na in line with science, kasi, for example, delikado kasi to, why? Before we give any food supplementation in this patient, so chine-check muna if the nasogastric tube is inside the stomach, because there are times na nabubunot siya. So pag nabunot siya, tumataas, pwedeng magpunta sa level nung papunta sa baga, pwedeng yung ibinibigay, pwede mapunta sa bagay yung ikakamatay ng pasyente, aspiration tawag natin doon. So, ayaw natin yon. So, kung walang nakakaalam kung paano gagawin dyan, wag na lang kasi baka lalong maging delikado para sa pasyente. No? So, kasi chinecheck namin yan, mga nurse, no, yung mga doktor, chinecheck muna kung yung tube nasa loob ng tiyan. So, pag nasa loob ng tiyan, so pinapatunog namin yon, pinupush namin ng syringe, binibigyan ng hangin. Pag kumulo yung tiyan, ibig sabihin, nandun sa tiyan yung tube. So, yun yon. Pero nga, kung hindi sigurado, wag na lang. Kasi delikado, ma-aspirate yung pasyente, nahugot pala yung tumaas yung tube, napunta doon sa level na papunta sa baga. Pag nagpasok tayo ng anything, food or food supplement dyan, no? So, baka mapunta sa baga, yun yung ikakamatay ng pasyente, no? So, ayaw po natin yan. So, kung kaya, kung merong nakakaintindi, why not? Pero kung wala, wag na lang. Kasi kung papayagan ng doktor na isasabay yung food supplement, why not? Kasi ipapaalam. Siyempre, pag ipinaalam natin yan, when we do ask a permission with the doctor, of course, they will permit it. If they do, yung nurse o yung staff na magbibigay ng pagkain sa kanya, pwedeng isabay. So, i-incorporate nila dun sa ibibigay na kung ano man yung ibibigay dun sa pasyente, pwedeng isabay. Sila gagawa, hindi ikaw. So, kasi nga, delikado na ma-aspirate yung pasyente po natin.
Thank you, Doc. Thank you so much, Doc.
Okay.
I guess no more question, right?
Okay.
Fine.
So yung mga nandito sa atin ngayon, our viewers are mostly OFW. Some are foreigners. I think nakikita ko yung iba para mga foreigner, no?
Yes, Doc. Yes, coming from Africa, from
Wow.
yes, Doc. Yeah, from India
So
here.
not only in Middle East.
Yes, Doc. There are Arabic people here as well, but they do understand English.
Okay, so just a reminder for each and every one of you out there, our products are really good, but then again, you should ask those conditions that I told you earlier, so we may be sure that our products can help properly your customers. But then again, if you do have, if it's not clear for you, you may message me personal on my FB account, Raschel Dalmasio Maguera, or in my fan page, Health Matters. Okay, again, if your customers should really be advised by their doctor to undergo the surgery. So again, they should be the one to decide on that, whether they may try the product first and they observe themselves for a few months before their surgery, or because there are some customers of ours that doesn't pursue anymore with their surgery because of our products. Okay, but then again, as I said to you, that they should be the one to decide on that and not you. Even in using our product, so they should be the one to decide on that and not you, because again, these products may help them. So, but again, don't make any promises. Why? Because our products of course have different reactions to different body. Because why? Because our body have different body systems as well. So as you can see, some persons are allergic to some kinds of foods or some kinds of medicines. Again, why? Because we have different body systems. So you may not give any promises. All you can say to them is that our products have helped so many diseases already, so have many testimonies with the use of our product. It may help you, so it's your decision whether you wanted to use our product first, or you wanted to pursue with your surgery, or you wanted to. Okay, if your patients have their maintenance being given by their attending physician, never advise them to stop the use of this medications. All you have to do is to share our products. You just have to take these products of ours simultaneously with the medicines that you are using right now, but you don't have any right to decide for them to stop their medications. Their doctors would only be the one to decide whether they be continuing their maintenance or not. If their doctors see, of course, that their customers or patients are improving, of course they will be the one to decide on that. Again, not you. Okay, so again, thank you very much for inviting me again in your group. So we will be having so many sessions with regards to our product, but as I said, that we have so many products to be discussed, and we cannot discuss it in one sitting. So we will be just discussing it one by one. So with the other sessions that we will be having next time.
All right. Thank you so much, Dr. Raschel. Can we
Yes.
a virtual clap for Dr. Raschel once again? And just to remind each and everyone po, we are going to have another as product session by Dr. Raschel on November 4th.
Is this would be the same group with the November 4, or that would be another group?
Yeah, I think it's same group, but actually this is all for all UAE. It's just that
Okay.
they're the one who held yung nag-host po.
Okay.
The one who hosted.
So the next session will be part 2.
Tagalog po. It's written here, it's Tagalog, Doc.
Kaya nga tinatanong ko kasi para at least, kasi kung, for example, if it's another group, we will be discussing the same thing. Pero kung same group, another topic na tayo. Kaya tinatanong ko.
Yeah.
Oo.
Same group
Message nyo na lang ako.
Pwede
ano.
po continuation.
Kasi kung continuation, another topic na tayo nun.
Sige po, Doc.
Okay.
Salamat, Doc.
Okay.
By the way, si Coach Karina po is the one who was communicating with you, but unfortunately, nagka-problema po sa Facebook niya, hindi niya ma-open yung Facebook. She wasn't able to communicate with you.
Tora, thank you so much. Pabol po ako
Okay lang yan.
from Laguna to here. And ang dami po naming natutunan. Thank you so much, Doktora. You're so
Yes, you're very
good.
much
Salute,
welcome.
salute sa inyo po.
Okay, God bless everyone. Keep safe, stay healthy, use our products.
Thank you po, Doc. Thank you po, Doc.
Yes,
Tawag ako sa'yo
you
kanina.
again. Yes.
Thank you po.
Thank you, Doktora.
God bless.
God
God
bless
bless,
you
Doc.
po.